Good afternoon. This is actually very exciting because a lot of you are in the finance industry and kind of starting out with Newgen a little bit. We've actually been partnering with Newgen for quite a while. So we're on the implementation, we've done implementation, now we're enhancing our processes. So Wellcare Health Plan is a Fortune 500 company. We have 3.3 million members. Our headquarters is in Tampa, Florida, with approximately 5,000 associates. Our primary focus is providing quality managed care services through government programs such as Medicaid and Medicare. So our engagement started with Newgen for our New York Medicaid enrollment in 2007, and we are currently still working with them with new projects. So our workflow, I will tell you, I'm in operations, so I'm not used to standing still. So our workflow process deals with end-to-end providers, from providers to hospitals. It's the contracts, the execution of the contracts, making sure that we have a very quick and tight turnaround time with pretty much like 99.9% quality. So that's where our main focus was with dealing with partnering with Newgen. So in addition to onboarding providers, we also have the changes, and with the healthcare industry, there's changes like daily, from terminating providers to making changes to making payment changes for the provider. So we have to be able to do that very quickly in multiple areas of the company, and also multiple areas of the United States, onshore and offshore. When we first started with Newgen, we, like everybody else, had a very manual process. It was so manual. We had, say, New York had to photocopy 3 sets of documentations, send it to us. It went to our mailroom. From our mailroom, it came to the operations department. We physically had to walk over to another building to bring the credentialing piece. So we took all of that, we put it into OmniFlow. So now the markets, which are the different states, they just scan the information in and it goes through the workflow. So our turnaround time was to get a provider onboarded, probably 90 days plus, and now we're down to less than 15 days. So one thing I did want to share was our business process flow. So like I said, there's, we have multiple provider relations reps across all the different states. So they now scan the documents in. It comes to configuration. Then based on the type of transaction, it goes to different areas of the company. Was very, a very good enhancement. So basically, they put the information into OmniFlow. If there's anything missing, for example, they said that the provider wanted to have their payments go to 123 Main Street, but they didn't supply us any documentation. Within OmniFlow, we can send them an email and say, hey, you have an exception, and clear that, give us the information we need, and we can move it on board. And we also have a turnaround time in reference to the emails. So the document classification, that also happens where we have multiple packets of 500 plus pages. The user looks and scans the images, and then they classify them. And this is what our OmniFlow looks like. And this is the distribution that I previously described. Again, this is with our OmniFlow. So there's multiple things that we do, because when it comes to us, it can come directly to configurations, and it can also parallel to credentialing. Once we configure the provider, we have it in our system, which is Excelis, then it goes to another queue, and a welcome letter is sent to the provider. In addition to all of this, we actually do have reporting that for every 3 hours reports out to us the aging of each record, so we can work the age. In addition to that, we now have, we're implementing where the assignments of records automatically go to the production staff. So the benefits. So it's a single system to execute and track contracts, processes approvals. Again, it goes through multiple departments within the company. We have one single interface for real-time processing, and it also allows us with the different business rules within healthcare. It's very flexible with the different business rules. So being in, production, we kind of go a little fast. So I've spoken to a lot of these. One of the other great aspect being in healthcare, because we change so frequently, and sometimes it changes hour by hour, I will tell you there has been multiple times where I have called Saras at 4 in the morning and said, I need to get this done. By 9 o'clock, we have a meeting, and we really work, pretty much 24 hours a day. So the greatest thing out of everything to me has been the customer service from Newgen and the flexibility. Thank you. Any questions? I'm sorry. The volume of documents. I have on average between 15 to 23,000 providers a week. Mm-hmm. Well, when we met with Newgen, they really understood our business and where we wanted to go, and with the fact we had a very short time frame. Everybody else that we met with was very, well, we can have it done in 2 weeks or 3 weeks. This was a very tight time frame that we had to have this done, and we need somebody that understands the business and the complexity of it, and Newgen understood it. They understood the complexity of it. They actually bring ideas as well, which is what we needed. Because we were like a mom and pop shop that went from mom and pop to Fortune 500 overnight, and it's so rapid that they were able to keep up, and they're still able to keep up with us. We consistently add states, and they're just right there with us, helping us. Did that answer the question?